Hey, nursing warriors! Welcome to NurseEdScholar. Today's focus is on hypernatremia, where the normal sodium levels of 135 to 145 milliequivalents per liter leap above 145. We'll dissect the causes, assessments, and crucial nursing interventions to tackle this sodium imbalance head-on. First off, let's explore what throws sodium levels off balance. From decreased sodium excretion to increased sodium intake and water loss, we're diving into the intricacies of how hypernatremia comes into play. Let's look at the causes, beginning with decreased sodium excretion, such as corticosteroids, Cushing syndrome, kidney disease, and hyperaldosteronism. Increased sodium intake, such as with excessive oral sodium ingestion or excessive administration of sodium-containing IV fluids. Decreased water intake, such as with fasting. Increased water loss can result from an increased rate of metabolism, fever, hyperventilation, infection, excessive diaphoresis, watery diarrhea, or diabetes insipidus. Moving on to assessments, understand how hypernatremia plays out in the cardiovascular system. Detect changes in heart rate and blood pressure due to response to vascular volume status. Identifying signs like pulmonary edema in the respiratory system, especially if hypervolemia is in the mix. Zooming into the neurovascular system, pinpoint the early signs of spontaneous muscle twitches and irregular muscle contractions, recognizing the late signs of skeletal muscle weakness and diminished reflexes. Navigate through the central nervous system, where altered cerebral function may reveal agitation, confusion, or seizures in hypovolemia and lethargy, stupor, or coma in hypervolemia. In the gastrointestinal system, extreme thirst is a potential indicator. In the renal system, decreased urine output is linked to hypernatremia. In the integumentary system, dry tongue, dry mucous membranes, dry and flushed skin, and the presence or absence of edema, depending on fluid volume changes. Uncover the lab findings with sodium levels exceeding 145 milliequivalents per liter and heightened urinary-specific gravity. For nursing interventions, understand the tailored approach based on the cause, from administering IV infusions to promoting sodium loss with diuretics, sodium and fluid intake restriction, and the potential use of D5W IV fluids to lower sodium levels. Plus, it is a crucial heads-up for diabetic clients. Monitor glucose levels closely to prevent hyperglycemia when using D5W. And there you have it, a deep dive into hypernatremia. Knowledge makes you better equipped to recognize, assess, and intervene. Keep soaking in that wisdom, stay vigilant, and make a difference in those patients' lives. If you enjoyed this video, please click like and subscribe to receive notifications for new content.